Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu broadcasting from Rochester Chiropractic Clinic, and we have our wonderful Dr. Jeffrey Haddad with us tonight.
Wednesdays are here again. I'm happy to be here. Good to see you again, Joe.
Boy, thanks for coming in again, Jeff. I really enjoyed last show. But, you know, before we get into the show, I'd like to do a little prayer and a little reading, okay? And this is from Romans Chapter 8, we are children of God through adoption, right? For those who are led by the Spirit of God are children of God. For you did not receive a spirit of slavery to fall back into fear, but you received a spirit of adoption, through which we cry, Abba, Father. The Spirit itself bears witness with our spirit that we are children of God, and if children, then we are heirs, heirs of God and joint heirs with Christ, if only we suffer with him so that we may also be glorified with him. What a nice passage, huh, Jeff?
That is very nice.
The Spirit that we are heirs in the kingdom, that we are adopted in. We've received the Spirit, and we don't want to fall back into the slavery of the law. The law cursed us, right?
Right.
We are free, man. Freedom!
I feel like a free man.
We are free. Well, you know, last show, you did this wonderful, you were telling me about Nancy, the caller Nancy.
Yes, Nancy, who was not free, was not free,
and you helped give her some freedom.
Absolutely.
So she originally came in with...
Well, you know, for those of you who weren't listening last week, Nancy came to us actually through the show. She was a call-in a few months ago, maybe a couple months ago, and just everything she was talking about on the phone just screamed of a TMJ disorder, you know, a temporomandibular joint disorder.
Well, she said she has excess bone growth, right?
Well, you're right, and these are called tori, and what that means is when you have extreme tension in an area, bone will grow there, as you know. You know, the chiropractic world is very familiar with that. And we see that in the mouth a lot on extreme clenchers and grinders, which not necessarily meaning if you're a clencher or a grinder, you have a TMJ disorder, but sometimes that can lead you down that path. Then, when she told me that, in addition to her headaches, in addition to her jaw pain, I started putting, you know, two and two together here. And so we saw Nancy. And last week we really just talked about a success story because we got her into one of my neuromuscular jaw orthotics where we determined her proper bite, her comfortable bite based on her calm muscles, because 90% of TMJ problems, like we've talked about, are all muscular in origin. That's a fact. That's not my opinion. That is a fact. So if it's muscles that are causing the problems, we need to address the muscles. We need to use the muscles.
Glad, you know, with you, you're one of the few dentists that actually addresses the muscles. It seems like
it's so important.
Why would you overlook that? Are you taught that in dental school?
No. It's unfortunate. You know, really, and it's not to knock the dental schools. It really comes down to not enough time to teach on some of these
cover
focuses.
It all.
Right.
There's so much.
There really is. And so, no, you're not taught that in dental school. You have to seek out extra training. As you know, that's what I do. And, you know, this neuromuscular approach really, it became the way that I feel like I was always looking for to treat my patients. It made sense. I've got science, data, and a computerized jaw tracking system that can measure my patients. I want measurement. We want objective data. You and I always talk about this. It's not about my opinion. I want it to be true data. And for me to look at a patient like Nancy and measure her muscles and say, all right, this is why you're in tension. This is why you're having your headaches. Let's see where your muscles need to be calm, and we find that position, and we register that position, that mandibular position. And when we make
so that is bedrock science then.
Absolutely. I mean, it's something that you can look at as a layperson, as a doctor, and say, okay, here's the before, here's after. Here's unhappy, painful, destructive muscles. Here's calm, happy, relaxed, healing muscles. And so we did that with Nancy, and within 1 week, which this doesn't happen very often, but we love to see it, 1 week she said that 90% of her pain and tension and facial symptoms were gone.
Wow.
It was a beautiful thing. We were all,
I remember you saying
yeah, she wore her orthotic for 1 week, and we're talking about years of muscle memory. This takes a long
destructive
time.
Bite.
Oh yeah, it's
right. The clenching down, as you were saying, the nose, the jaw coming together. Mm-hmm. Plus, when your muscles are in this state of contraction all the time, you get a buildup of toxins, right?
Got it. Lactic acid buildup. You got it.
Carbon dioxide, calcium, and muscles start to become fibrotic, and you actually change the nice healthy muscle into this cheap grade of fibrotic tissue, which can rip and tear. And
that's great. I mean, that's a perfectly said.
So this jaw tracking machine you have. Mm-hmm. You said, I always want to call it the K9.
I know you
K9.
do. The old the K9. Yeah. The K7 jaw tracking system. We're dealing with humans here, Joe. Come on. We are,
K7 jaw tracking system.
It gives me the information I need to do what I need to do. You know, you have to be trained to use this. We're one of very few dentists in the entire state to even have this equipment, much less to be trained to the degree that we have been. And so it's been great. It's been invaluable tool for me to treat my TMJ patients, my migraine patients, my neck pain patients, which is what we're going to get to today, because as excited as I was about Nancy's progress, if you remember at the very end of last show, we talked about the fact that I noticed right as I met her that she had an airway issue. And on her little questionnaire that was very thorough in my office, she says that she's suffered from sleep apnea in the past, and that does not surprise me.
That's always a red flag for you.
Big one, big one.
I think most dentists don't even, you just don't equate apnea with dentistry.
No, you don't.
Most people wouldn't even think to tell her dentist, hey, I have a breathing problem, right?
No, even patients of ours for decades don't know that we do that unless we tell them. You know, you're right. Yeah. I mean, most of the layman would never think a dentist would be versed in that arena.
I have sleep apnea. I better go to my dentist. You wouldn't think.
No, we're probably fourth on the list, I would say. Mm-hmm. You know, luckily a lot of the physicians, the sleep physicians, the cardiologists, the ENTs in town. You know, luckily we have a great relationship with them, and we do have a lot of patients referred to us because, you know, let's say you do have some, sleep situation, you're snoring. Well, you're probably going to talk to your family doctor maybe. Maybe they'll refer you to a sleep physician for a true sleep study. Maybe some of the snoring is manageable, but you've got some ear issues, which, again, can go hand in hand.
Sure.
So you go to the ENT. Well, again, we end up seeing people a little bit further down the list. I wish we saw them sooner, but I'm just glad we're seeing them. I mean, I'm happy that they find us. And a lot of these things just go hand in hand. And, you know, the big stat that, you know, we've talked about is TMJ patients. You know, when I hear somebody who has TMJ pain, the next thing I ask, do you snore? Do you, are you fatigued during the day? Have you ever woken up gasping for air? And the answer is yes, a lot of times. Well, 75% of the time. 75% of TMJ patients have some sort of sleep disorder. That is the latest research. So these are the same people, you know. And on the other hand, sleep apnea patients, 52% of them have TMJ symptoms. So we're really talking about a lot of the same people here.
A lot of the same crowd.
Yeah, and
for sure. And, you know, it's interesting. This is the first time you brought up the ear. Mm-hmm. You know, as chiropractically, you know, the muscles in your neck can start to close off. The eustachian tubes, right, and the jaw, the masseter. And
that's what I love about
these anterior scaling muscles.
See, I think I'm getting as excited as you do when we talk about amalgam, because that is I love that you said that, because we deal with the same thing, and it's similar. We're having other muscles. I mean, you think about where the TMJ joint is. It's right in front of your ear. There's a lot of muscles that are attached there, blood supply, nerve supply, and if there's tension in that area, what does it do? Cuts off nerve supply, blood supply to the inner ear, causing vertigo, dizziness, ear congestion, ringing in the ears, I'll tell you, that's got to be our next show. It really should. I mean, we really should
cover
talk
that
about
next show.
I mean, just ear symptoms.
So
in
easy
general.
to get. There's so much to talk about.
I know, so little time.
Yeah.
but I know, and I love what you're saying. I mean, that really is the connection. All these muscles, and again, upper cervical into my arena, which is with the jaw. It goes hand in hand. I can't do it all, and a lot of times you can't either. And so it's great to have this relationship and have that knowledge and kind of know what you can do and what maybe you need some
limitations or in conjunction.
Agreed.
Sometimes we're a piece of the puzzle. Chiropractic's a piece of the puzzle, and then you need dentistry to hold it. But getting back to Nancy,
right?
I know we're
getting all excited about all these other things. I'm sorry. I'm bringing it back. I'm sorry. So Nancy.
Yeah. So she originally comes in with the jaw pain, TMJ, and then you find out she's got apnea as well.
Right, and so
I hook her up with this little bite splint.
Well, we get her. We're getting her facial pain is truly being controlled right now, and
I'm so happy.
And she's
her.
Not done with me yet. I mean, we talk about this therapy being about a 3 to 4 month therapy, and even though we got success in the first week, I need to let her body unwind because she's going to need some adjustments on this. I need to follow her body, and that's really people always ask me, well, why does what you do work and guy down the street doesn't? I use the patient's body. I'm not forcing them to do anything. I'm letting your body, your muscles guide me. I'm going to start you off in this very educated position based on your posture, based on your muscle activity.
Sure.
But you're going to come back.
I love that philosophy. I mean, that's our philosophy too, that we need to gently assist the body and not be invasive and intrusive and this aggressive treat. It's not aggressive.
No, and it's really just letting the body show me the way.
Okay.
And it helps. And so, she's going to be with me for the next few months. But in the meantime, I'm happy that her facial pain is under control. But as we've talked about, sleep apnea is the silent killer. And, every day that Nancy goes without a CPAP or goes, without any type of appliance, she is truly dying a little every night. I mean, I hate to be so morbid, but you stop breathing enough during the night, oxygen's cut off to your brain. Oxygen's cut off to your heart. This is not good, okay? This is a very serious condition. And so what I do, not only do I take a look down the airway, I should have brought photos for you of Nancy's airway, but I mean, you could barely see down it. She has her tonsils and adenoids still. And
are they enlarged, Jeff, her tonsils and adenoids?
Very, very much so, in addition to a small airway. And so I literally have.
But she has a lot going on.
She does, and it's almost. Well, it's the chicken or the egg.
Yeah.
What started? Was this an airway problem years and years ago, and it caused her to become a clencher? Because as you clench, what does that do? That opens up eustachian tubes. It starts to it helps the breathing in a person a lot of times. It's you think about you going up in an airplane. How do you clear your ears? Chewing gum, right? I mean, and so these are tricks that a patient will even use at night, trying to breathe, trying to clear their ears.
So it's like an involuntary reaction. The clenching is really the clenching is not the root issue. It's fighting to keep for survival.
That's what I believe, and that's what a lot of research is showing. And so her main and chief concern was her pain, and I've gotten that under control. But my chief concern is to keep my patient alive.
See, this is a whole nother aspect because you always think of, you're under stress and you're tense, so you're clenching down. What you're saying is you're really clenching down to open the eustachians and the airway.
That in a lot of cases.
That you're in some cases where you're fighting for life, and that will cause tension, stress, right? You can't breathe.
Well,
so subconscious, it's almost like an involuntary reflex, right?
No, I agree. And listen, life is stressful. We all have been there, I've told people before, I grind at night. I wear an appliance at night. And people who go through times of stress, they're going to clench a little bit more. But usually the clenching and the grinding, it's always happening to some degree. You may do it a little bit more during times of stress or whatever, but it's kind of always there. But on an airway patient, like Nancy, you're right, it's fighting for survival. And so my goal is to get her pain under control and keep it there. But I need to plan for what we're going to do to keep her airway open. Now, I may need some assistance here. I make an appliance, as you know, and it's customized, adjustable sleep apnea appliance, and it's amazingly comfortable. Our patients love to wear them because they feel so good afterwards. However, it can only do so much. If you've got a small airway or an obstructed airway like Nancy does, and I want your opinion. I know how conservative you are, and I try to be conservative too, but when it comes to surgery, a lot of people are a little hesitant. When it comes to tonsils and adenoids, what are your thoughts? Because if I see a problem, I would love to get rid of them with non-surgical means, but sometimes it's not.
Sure.
It's not possible. And so,
Right.
if we know that there's an obstructed airway, what do we do? You know, I mean, I know what I do. I have my ENT take a look at them, and they know what we do. Now, if they said, nope, they're fine, then that's fine. They're the expert. I am going to let it go at that. But a lot of times they just don't get a chance to see the patient. And when they finally look down there and say, wow, yeah, this is a problem. And once they hear that word apnea, that's a big red flag for them, too.
Red flag.
You know, they know that that's a problem.
Yes.
And getting the tonsils and adenoids, even though it is a surgery, could be the best thing for these patients to do. It could be, it's a lifesaver. It really is.
Yeah, well, what's really important as kids, as young kids, when you have chronic inflammation, right? Now, there is a point where they're just so chronically inflamed and they've developed fibrotic tissue. They're big, and I hate to say it too, you know, when it affects your breathing, you're going to need to have them out.
Correct.
Right? But before it gets that way, there are things to do to get rid of the inflammation. Okay, there's some strong natural herbal thing. You know, there's the healthy chocolate, for one, which gets, you know, high antioxidants.
Yeah.
What's causing inflammation? Free radicals. So how do we mop up the free radicals? Plus, every morning, the lemon water with the honey, cayenne pepper helps to shrink, and ginger helps to take out inflammation. And dandelion tea, you know, if you're going to drink dandelion peppermint tea with some honey and lemon, put a little bit of cayenne. If we can get the swelling down. If you can, but there's a point, like you said, you try for 3 months. I mean, give it 3 months.
Sure. Why wouldn't you?
Of getting on a regime of trying to gargling and having it bathe your tonsils, and if that won't shrink it, then there's always a time for everything. Then, unfortunately, I'm not an extremist. There's a time for surgery because I know there's some tonsils that they're too far gone.
Right. No,
they're just too. It's like a cavity. At this point, there's no brushing and flossing. Right. It's rotted to the core. You need to do something more invasive, but it's always a last resort. But Jeff, I'm with you at that point. You know, I'm probably more conservative to try something natural first for 3 months, see if it shrinks up.
I am okay with that. And I guess the next question really is, though, at what age is it appropriate, too? You know, I've got a woman who is 59, I believe. She's had this problem. She's had sleep apnea for many, many years. She's had this obstructed airway. When I look down there, it's less of inflammation and more just enlarged and a small airway. Now, unfortunately, our listeners can't see what I'm about to show.
So you think it's anatomically a smaller
That's correct.
airway?
That's correct. That's what I see.
Like you can anatomically have smaller eustachian
you got
tubes.
It.
Or
in her case.
I know in chiropractic, some people, their vertebrae have large holes where the nerves come out. Consequently, they can have a significant misalignment of their vertebrae and have no pressure on the nerve. Other people, you know, the holes are smaller, a slight little misalignment, and wham, they've got nerve pressure and pain down the leg, or, you know, it's more symptomatic.
We use the term narrow goalpost or wide goalpost people, right? There's the wide goalpost that I'm telling you, I could put a block of wood in their mouth and they're going to feel fine. And there's other people that you put the smallest little filling and it's bugging them. They know it's there. So, I think we all accommodate to our own different parameters,
anatomical
and different
structure.
Yeah, and so I agree with you. And when it comes to kids, Believe me, parents never want me to tell them that their kids need their tonsils and adenoids out. I never want to tell them that. But I also know what these kids turn into because I see the adults.
Right.
They're TMJ sufferers. They're sleep apnea sufferers. They have orthodontic issues, jaw development issues because they have been forced to. They're fighting to breathe this whole time. They have a raised, a vaulted palate, meaning a real V'd palate. You know why? Because their tongue is jammed to the roof of their mouth, trying to open up their airway.
Trying to open it up.
I've had patients who have been in orthodontics 3 times, and they keep failing. The orthodontist doesn't get it, and I look, and the kid just is fighting to breathe. That tongue is a very strong muscle. If you are trying to open up your airway, it's going to move everything out of the way. Okay? Now, I want to show you something here, Joe, and I know this is radio, so I apologize, listeners, but I happen to have this little presentation I'm giving, and coincidentally, I just thought of it as we're talking.
And I am privy to it.
I want you to take a look at that. Now, that is the classic child that I see.
Wow.
Okay?
Allergy, shiny,
the allergic shiners underneath the eyes, right?
Baggy eyes,
crusty nose, right? Open mouth posture. You know,
right.
Take a look at this now.
Wow.
You know, there's another one. Okay, these kids all have those droopy eyes. They look like they've been up all night, even though they've slept. And these are the kids that are just not getting the not healthy sleep, not getting down to that good REM sleep. They're gasping for air. And I'm going to make the analogy of this: wisdom teeth. You're familiar with wisdom teeth, and really, anatomically and as far as your bite goes, they serve no purpose whatsoever. They did at one time. They don't anymore. There's no functioning purpose for them. But do I just take them out of everybody? Absolutely not. But I look at them as problems possibly waiting to happen. I watch them. If they become a problem, we don't even think twice about getting them out of there because they can cause harm to the rest of the teeth that are actually truly helping you function, or just being a difficulty to you from an oral hygiene standpoint and keeping your gum tissue and overall mouth healthy and clean. And so I say, all right, we've tried. There's not enough room for them, or you know what? We've got decay in them. We need to just get them out of there. But it's a last resort. I view tonsils and adenoids the same way. If they're causing a problem, I totally agree with you, and I love the conservative approach. Let's see what we can do. If we can shrink those down from a lifestyle change, beautiful. If we can't, we need to say, all right, we need to get these out of here because it's going to be a big problem.
Life-threatening. Now, Jeff, you know what breaks my heart? And with these kids, we can make a lifestyle change because obviously, like you all were saying, when you have the ear problem, or what's causing the TMJ? Why are you grinding? Even the grinding isn't the root cause. There's something you're trying to open up airways.
Right.
Now your tonsils and adenoids are there for a reason, right? They're
correct.
A filter system.
That's correct.
So that the bacteria and toxins don't go into the body. Why are they overloaded? Okay.
That's a great question.
So really, it is a life. Now,
our environment doesn't help, does it?
No, it doesn't. Now, when you're 59 and you've had this chronic, and it's all fibrotic, there's not as much as we can do as your children.
Right.
You know, the MSG, the high fructose corn syrup, the artificial sweeteners are a huge. Those are some major factors.
Yeah.
So is the soy and just toxins and food. You know, the processed foods. So you really, as parents, now you got to think, what do? You really do need to make a serious lifestyle change for your kids or have them out. But they're there for a reason. And if they're swollen, that's not the answer. There's a deeper answer.
Correct.
Why are they swollen?
Yeah,
right.
And I think the best advice to parents, that you're talking about is do something about it. Okay. I don't want parents to be afraid of or avoid surgery for the kids. God forbid, we don't do harm to our children. However, you could be doing more harm by not doing something. Whether you change their diet, whether you get them checked out for allergies, whatever you need to do something. And if it is surgery, if that's the only option, please do it because I'm telling you, the patients that I see, the adults, they're dying on us.
Right.
People have the morbidity rate is unbelievable.
These poor kids are having a problem. And you know what, Jeff, I hear you on this fact. They're not getting oxygen to the brain, and they're getting the part of the droopy eyes is allergies to something else,
correct,
right? Causing the airways to be obstructed in the first, but it's killing them,
correct,
and it's robbing them of a long, healthy, vibrant life. So either you got to make a lifestyle change or have surgery. one or the other.
Yeah, a lot of these kids I was going to say, I'm sorry, a lot of these kids even get labeled ADHD because they can't hear. They're so plugged up. They're trying, they're, again, back to the eustachian tube.
Well, that was me as a kid, too.
Well, yeah.
And I think I had dairy allergies.
Yeah.
Baggy circles under the eyes, always ear infections.
Well, you definitely still have ADD. Yeah. I can tell that already. But I like that about you. No, it is. It's one of those things that we really need to pay attention to. And, as dentists, I hope that all dentists are taking a look at things because we have the best intervals and times to look down somebody's throat. It takes all of about 4 seconds to take a look down a child's throat or adult's throat to really get an idea of if there's an airway problem. And I think that's our job to pay attention to that.
Well, that's great, Jeff. Unfortunately, we are out of time.
It always goes so fast.
We definitely, the tonsils, I'm glad you brought that up. If your kids should definitely be checked when they're younger. When you're younger, that's when we need to deal with and really go to a dentist who's going to observe airway and be conscious about that.
Very important.
And try to do something with that soon. I would like to get next show to talk about the forward head tilt.
You read that right. You're right.
Okay, you talked about clenching the jaw as a reason of obstructed airway, but also the head tilt would be a wonderful thing.
That sounds good.
Okay, so remember, so Jeff, he's on our simpletruthsforhealthyliving.com. You can listen to the show. Your number.
Our phone number at the office is 248-656-2020, or you can go to our website. We've made some recent changes, which I'm excited about. It's RochesterAdvancedDentistry.com. Please feel free to go there. There's a lot of good information there for you.
Thanks so much, Jeff. So you can reach him at 248-656-2020, Rochester Advanced Dentistry. Can you come back on next Wednesday and we'll talk about that?
Every Wednesday, I am here with you.
And remember, in all that you do, eat, or drink, do all things to the glory of God. Have a good night. We'll see you tomorrow, 10:30.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.